Okay, so we'll go ahead and get started. Hi, everyone. Welcome. Thank you for joining us today. My name is Tori Gutierrez, and I'm a financial advisor with Cetera Investors. On behalf of the LA office, your financial advisor, and my team, thank you for setting some time aside to educate yourself on something as important as Medicare. And as financial advisors, our goal is to guide you in your journey toward improving your financial well-being. And one really important part of that is having a plan when it comes to Medicare. And that's, of course, why you're all here. So again, my name is Tori Gutierrez, and I help my clients plan for their retirement. And I'm excited to introduce one of our partners, our dear friend and certified Medicare expert, Fanny Pacheco from PBI Insurance, who will be educating us on the basics of Medicare today. Fanny has helped many of our own clients, and so I appreciate the care that she takes with each one of them. So without further ado, I'll let Fanny take the floor. Thank you for being here, Fanny.
Thank you, Tori. Okay, we'll get started. This is a busy Medicare open enrollment season, and I do want to start by pretty much it's a disclosure. Whether you are enrolled in Medicare or maybe you have been even started your research, maybe this is the first webinar you're hopping on and when it comes to Medicare information, the Medicare open enrollment begins October 15th and runs through December 7th. And if you are age 64 and above, your name is maybe in some list. And so you will receive a lot of Medicare marketing and advertisement. And that tends to confuse people because sometimes they haven't even signed up for Medicare. And so they don't know why you're receiving all this information. And some of the marketing that we have seen this year looks very legitimate. It almost looks like it's coming from Social Security or the Centers for Medicare and Medicaid. But just realize that, anyone calls you or you call them back, please do not share your Social Security numbers, your personal information. So just wanted to give that disclosure because I know that it's happening a lot as of recent. With that said, we'll get started with our Medicare basics. And PBII, our primary focus is on Medicare products and how they can best fit everyone's individual needs. And we'll start with what is Medicare? And Medicare is federal health insurance program for people who are 65 years of age or older and certain younger people with disabilities. So there are a lot of younger people with disabilities. And if someone actually signs up and becomes disabled through Social Security and starts collecting disability benefits, on the 25th month of having started collecting those benefits, they become eligible for Medicare. And it doesn't really matter how old they are. And that's how we find that lately we have a lot of individuals who are younger than 65 and are also Medicare eligible. You do have to have worked at least 40 quarters or 10 years and contributed to Medicare FICA taxes. So I know that there's certain situations, there's certain types of careers where individuals didn't contribute to Medicare FICA taxes, and so there's certain restrictions there where you'll have to pay a little bit more for your Medicare, but you are still eligible for it. You do have to be a U.S. citizen, legal resident who had lived in the U.S. for at least 5 continuous years. Now, I see someone raise their hand. We will open the presentation to questions at the end, if you don't mind. We'll go on to the next slide. There's 4 parts to Medicare, and this is what you see everywhere. You hear about Medicare Part A, B, C, and D, and this is the alphabet of Medicare. And I'll touch on what each one of these parts means and what they are. We'll start with Medicare Part A. Part A is hospital coverage, and Medicare Part A has a 0 premium if you work 40 quarters or 10 years and contribute to Medicare FICA taxes. Medicare Part A is a portion of Medicare that covers you when you are admitted into a hospital. So you are admitted not just at the urgent care, not just at the emergency room, but actually admitted into the hospital. Medicare Part A has a deductible of $1,556. This is a per episode deductible. So in the world of Medicare, this deductible comes along every 60 days. And a good example is if you go into the hospital and you are there for 5 days, you would have paid the $1,556 deductible. If you are released and you are home for 90 days, then you go back into the hospital, you would pay this deductible again. Now, if you are hospitalized and remain in the hospital for 60 days, on day number 61 and above, you would have a per day copay. And those copays start at $380 per day for day 61 to 90. And then from day 91 to 150, it jumps to $780 per day. So that's the hospital Part A coverage in Medicare. Now, Part B, medical, is what covers your outpatient services. So everything outside of the hospital will be covered by Part B. And this is the bulk of where, people utilize when it comes to Medicare coverage. And Medicare Part B is not premium free. You do pay for that. The base amount is $170.10. Now, if you turn 65 a couple or a few years back, Medicare had a different rate. So last year, Medicare was $144. And so this premium, the base amount changes every year, and it does go up every year. We saw the largest increase ever from year 21 to 22. So for anyone signing up effective 2022, your Part B premium will cost you $170.10. You can pay more. You can pay up to $578. This is based on your modified adjusted gross income. So if you're a high income earner, you actually pay the $170.10 base amount, and then on top of that, you pay an IRMA fee. And that IRMA fee doesn't buy you anything. It's just an additional fee that you have to pay because you are a high income earner. Medicare Part B, even though you pay for it, it has a deductible of $233. This is an annual deductible, so it's a very small deductible. But Medicare Part B only covers 80% of the services. You are responsible for the other 20%. And there's no limit on the 20%. So you can be responsible for 20% of $200 or 20% of $200,000. There's no cap on that 20% that you would pay under Medicare Part B. Now, Medicare Part A and B, it's what is known as Original Medicare. You sign up for A and B through the Social Security office. And it doesn't matter if you're in California, Arizona, Texas, or New York, the benefits are the same. The premium bracket is the same. And so this is the national program. Now, Medicare Part C and D, these are plans that are offered through private insurance companies. And Medicare A covers hospital, B covers outpatient services, but neither A nor B actually cover prescriptions. So when you go to the doctor and the doctor writes you a script, it is not covered by A and it is not covered by B. And so what people do when they are enrolled in Medicare and to obtain coverage for their prescriptions, they either sign up for Part C, Medicare Advantage, which I will touch on in more detail, or they sign up for a Part D, like drugs, and this is a prescription drug program. And these drug programs have premiums. You pay extra for those, and they can range from $8 all the way to $160. It's specifically based on your type of medicines. And I will touch C and D in more detail. They have their individual slide. But I always like to first start by showing the ABCD because I feel like you see this a lot. So it's always a nice place to start. So what happens, when do you sign up for Social Security or when do you sign up for Medicare? If you are receiving Social Security benefits, whether this is your personal benefit or spousal benefits or widow benefits, if you are receiving Social Security monetary benefits when you turn 65, you will be automatically enrolled in Medicare Part A and Part B, and the Part B premium will be pulled from your Social Security check or your Social Security deposit. It's automatic. If for an X reason you do not want Part B, maybe you're still working and you have coverage through that employer or you have another source of coverage and you don't want Medicare at the time, you would have to decline and disenroll from Part B because it is automatic for you. Now, if your coverage begins on the first of the month, if your birthday is May 25th, your coverage starts on May 1st. If your birthday is May 1st, then your coverage starts on April 1st. So you get an entire month in advance. Coverage always starts on the first of the month of your birthday month. Part C and D are not automatic. Again, these are through private insurance carriers. And so this Part C and D require that you do some research and you actively sign up into the plan that you've selected. And again, I'll touch in more detail when it comes to C and D. Now, if you are not receiving Social Security benefits when you turn 65, then nothing really happens. Social Security doesn't reach out to you, Medicare doesn't reach out to you, but you will receive 3 inches of mail every day when it comes to advertisement. And so, I started the presentation by just giving you this warning when it comes to advertisement. And again, if you're not collecting Social Security benefits, Medicare doesn't reach out to you, Social Security doesn't reach out to you. Everything you receive in the mail is marketing materials for different types of plans. Medicare, they just do not reach out to you. That won't happen. But we do have there's 3 different periods for you to sign up for Medicare. And most people sign up for Medicare during the initial enrollment period. And this is a 7-month window that begins 3 months before your birthday month and ends 3 months after your birthday month. So that gives it a total of 7 months. And something that happens all the time, it's very often when I meet with someone new, I have a new client, they're always in a rush, or they're worried because they think that they have to sign up for Medicare 3 months before their birthday, and that's when Medicare will kick in for them. And so that is not the case. Your initial enrollment period begins 3 months before your birthday month. So if you have an April birthday, your initial enrollment period will begin on January 1st. And that's just a time for you to start researching your options. This is a time for you to contact Social Security, decide whether you're ready or you want to go on Medicare or not. And so you start the process, you start your research 3 months before your birthday, but the soonest that your Medicare will be effective is the first of the month of your birthday month. So again, if you have an April birthday, and that's April 25th, April 1st will be the first, the soonest your Medicare coverage can be effective. So you don't have to sign out on, the first month of 3 months or 6 months before your birthday. It's a 7-month window. When you're new to Medicare, you can sign up by phone, you can sign up in person at the Social Security office, or you can sign up online through My Social Security. Enrollment in Medicare is processed through the Social Security office. And so that confuses a lot of people, because when someone's ready to sign up for Medicare, your first incline is to contact Medicare, but you actually sign up through the Social Security office. Once they're done processing your enrollment, then your file gets moved to Medicare. So that's through, again, Social Security. And if you want to do it online, if you want to process your enrollment online, you'll have to create a My Social Security account. Now, if you do not sign up during your initial enrollment period, that first 7-month window when you're newly turning 65, most people have a special enrollment period. And this special enrollment period applies to individuals that work for large companies. So if you're someone who works for a company with over 20 employees, so you work for Coca-Cola, or you work for the city, or you work for the state, you have a special enrollment period. And so if you do not sign up for Medicare when you first turned 65, you can sign up for Medicare at any time while you are still covered by that large employer. And we're very specific in terms of large employer, because if you are someone that works for a small company, maybe a company that only has 5 employees, then that doesn't qualify as a large employer, and you don't have a special enrollment period. This means that you have to sign up during the initial enrollment period. So these are the different times to sign up. If you miss your initial and special enrollment period, there's always a general enrollment period, which runs between January 1st and March 31st. You sign up for coverage, and then your Medicare becomes effective on July 1st of that year. Now, they used to make you wait all those months, and people used to go without coverage. This is going away in 2023. So anyone that signs up between January 1st and March 31st, your Medicare coverage will be effective the first of the following month. But do know that if you utilize the general enrollment period to sign up for Medicare Part A and B, or just B, you will be tackled a late enrollment penalty. You always want to make sure that you enroll during your initial enrollment period, or that you are utilizing a special enrollment period. And this is something that you have to make clear to the Social Security representative that is processing your enrollment. So part of this webinar, we also hope that you learn what questions to ask when you go to Social Security. So those are the 3 different time frames when you can sign up for Medicare. What happens if you turn 65 and you're still working and you're not planning on retiring? We see this a lot nowadays. Again, if you work for a large employer, if the company that you work for has over 20 employees, we do recommend that you confirm with your HR department that your medical plan meets Medicare's Part D creditable coverage criteria. because Medicare does have two late enrollment penalties, and one of them is the Part D. And so this is very specific and it varies by plan. And we have met employers that maybe offer 4 different medical plans where 3 of them meet the requirement for Part D and 1 of them doesn't. So again, you want to confirm with HR that the plan that you are enrolled in meets the Medicare Part D creditable coverage criteria. And what this means is, it means that your medical plan offers prescription benefits that are better than anything you can find via Medicare. We also recommend that you compare what your employer coverage will cost you versus what you can find or what you can enroll with through Medicare. Sometimes you end up saving money by signing up for Medicare, and a lot of people don't realize that. We do recommend that even if you plan to keep your employer's coverage, you sign up for Medicare Part A because it helps down the road. It helps provide hospital coverage if you were to be hospitalized, and it does help you with some additional services, again, when it comes to the Part A hospital coverage, but it also helps expedite your Part B enrollment down the line when you're ready to go on full Medicare. The only time we don't recommend that you sign up for Part A is if you are enrolled in a health savings account. There's different tax rules that apply to HSAs, and so then you wouldn't want to sign up for Medicare Part A, just no part of Medicare. Now, if you work for a company that has less than 20 employees, like I said, a small employer, then it's different for you. In this situation, Medicare's primary payer for these companies. And then even if you keep that company plan for the small employer, that plan is secondary, Medicare's primary. And if you don't sign up for Medicare when you're first eligible, you may have to pay a late enrollment penalty. So, if something that I want you to pick up on is that Medicare is very unique. It's very specific. There's very little of it that it's generic. Everything else, it's affected by the type of employer that you have, the type of plan that you have, how large the company is. So it's very unique to you, and there's a lot of rules, and there's a lot of exceptions to rules. Now, I will touch on HSAs quickly. If you or someone that you know is enrolled in an HSA, health savings account, what is so unique about them is that they allow you to make pre-tax contributions into a savings account that belongs to you and you can take with you. And so you can make these pre-tax deposits. So Medicare states that if you take any tax advantage and make HSA contributions, you are not allowed to be enrolled in any federal program, and Medicare is a federal program, and so there are tax penalties associated with that. And that's why we say that if you are enrolled in a health savings account and you have this type of account and you make this type of contribution, you don't want to sign up for any part of Medicare. So if you have an HSA, you will want to get with an advisor that specializes in Medicare, because there are there's timeframes of how to plan your Medicare enrollment. Now we're jumping into when someone's ready to go on Medicare. So, you either have decided to retire, or you are, you own your business and you turn 65 and you want to go on Medicare. You'll have to sign up for Part A and B. You pay the Part B premiums, the $170.10. And there's a lot of choices that you will have to make when it comes to Medicare. And the very first one is, what type of coverage do you want to have? Do you want PPO type coverage, or do you want HMO type coverage? And so Medicare A and B, those are the core benefits. Again, you always sign up for those. But if you have had an HMO, all your life through your employer, you're familiar with that system, with the program, your doctor accepts Medicare HMO plans, you will most likely transition to a Medicare HMO plan. And how do you choose your Medicare HMO plan? Well, how do you choose your Part C plan? Something else that you probably caught on to is that Medicare utilizes multiple names for the same item. So Part C are Medicare Advantage plans. These are mostly HMO plans. They're the same thing. And so how do you select a Medicare HMO plan? I'll start by telling you that Medicare Part C plans vary by county. So you may have a friend that lives in LA County and she tells you how great her HMO is, and she pays nothing when she goes to UCLA or Cedars. But if you live in Ventura County, that plan may not be available for you. It's county specific, and so they're different. Part C plans, they tend to have a zero premium. So again, you pay your Part B premium, the $170, but you don't pay anything extra for the Part C. And how do you choose a Part C plan? Well, we choose the plan or we help eliminate plans based on which plan will cover your prescriptions and which plan will give you access to your current providers. As an example, Anthem has 20 different Part C Medicare Advantage plans, and each one of their plans has a different formulary. A formulary is the list of medications that each plan covers, and each one of the plans has a different network. Network is the providers that you have access to. So even though, again, this is Anthem Blue Cross, they have 20 different Part C plans, they are all different. And so that's why we have to really dig into your needs and be able to pair you up with the one that will best meet your needs. But these plans, once you sign up for a Part C plan, you no longer have to worry about that Part A hospital deductible or that 20% that you're responsible for under Part B, because now you are subject to your HMO plan summary of benefits. And so most of these plans have a zero copay when you go to the doctor, zero copay when you go to the specialist, zero copay if you're admitted to the hospital. They're very rich benefits. And these are called bundle plans. And so they include a maximum out of pocket. They limit your out of pocket exposure for medical services. And in LA County, some of these plans have a maximum out of pocket of $700 per year. So that's very low for medical services. These plans do tend to offer vision, optometry benefits. They offer dental coverage. They offer hearing, acupuncture, chiropractic. They offer free fitness memberships, and they include your prescription coverage. This is why part of the selection process is based on which plan covers your medicines the best. Now, the out-of-pocket for prescriptions is not the same as your out-of-pocket for medical services. Like I said, in LA County, some of these plans have maximum out-of-pocket for medical services of $700, but the prescription out-of-pocket is actually dictated by the Centers for Medicare and Medicaid. And for 2022, that magic number is $7,050. And I'll tell you how prescriptions work in Medicare. So someone signs up for Medicare A and B, and then they choose their HMO Part C plan. Based on the list of your medications, Medicare breaks prescriptions into tiers. There's tiers 1 through 5, where tier 1 has a copay of $0 to $5. Tier 2 has a copay of $5 to $15. And then tier 3 has a copay of $35 to $47. Then tier 4, you pay a percentage of the cost of the drug. And so you and I can both be enrolled in the same Part C HMO plan, but my drug coverage when I go to the pharmacy each month could be $100, $200 if I take 2 medicines and they're both tier 4. Your drug coverage when you go to the pharmacy could be $5 for 10 medicines if all of your medicines are tier 1. So your copay when it comes to prescriptions is very specific to what you are taking. And in the world of Medicare, it matters if your prescription is a tablet or a capsule, if it's a cream or if it's gel for ointments. So all this affects the cost. And so that's why we help navigate that for you. And you have to take that into consideration. Now, everyone who is enrolled in a Medicare HMO plan, so this is someone who's already signed up for full Medicare, they get to review this plan. Open enrollment is between October 15th and December 7th. So if you were unhappy with your plan in 2022, this is the time to review it and your plan can change for 2023. If you're happy with your plan, then it's just an automatic rollover. You don't have to do anything, but this is the time to renew. And this is how you would choose your Part C plan. Now, if you are someone who's always had a PPO, so you want that freedom to go to any doctor that accepts Medicare assignment, Medicare Part A, you sign up for all the time. B, you sign up for that. You pay your Part B premiums to Medicare, Social Security, and then you have to sign up for a Part D drug coverage because if you remember, I mentioned that Part A and B does not cover medicines. So you would sign up for a Part D standalone plan and you pay for that plan. And then on top of that, you would sign up for a supplement plan, or they're also known as Medigap plans. And this Medigap plan will pay the deductible from Part A, will pay the coinsurance from Part B. And so now this is a coverage for someone who wants that PPO type coverage. And with Medicare A, B, and D and supplement, you can go to any doctor anywhere that accepts Medicare assignments. So you can go to the Mayo Clinic in Arizona, or you can have surgery done in Utah if that works best for you. There's no restrictions. It's a national program. And how do you choose your prescription drug coverage? Well, again, it's based on your medications, based on the drugs that you're taking, if you're using tablets, capsules, and prescription drug plan premium have deductibles of $480. This deductible is dictated by CMS. So every plan has this deductible. And again, prescriptions are broken into the same 5 tiers. Tier 1, $0 to $5, and then tier 4, you pay a percentage of the cost of the drug. And your potential out-of-pocket spending in drugs could be up to $7,050 for prescriptions, even on the Part D plan. So it doesn't matter if you have your prescriptions through a Part D standalone program or through your HMO Part C plan, your exposure is the same. It's $7,050 because, again, this number is dictated by CMS and it changes every year. Last year, the maximum was $6,850. This year was $750. We're waiting to see what it will be for 2023. Now, anyone who has a prescription drug plan, they get to renew their plan between October 15th and December 7th. So this is a time where if you were unhappy with your coverage, again, you get to renew it, we can change coverage, and then your new plan begins January 1st, 2023. That's how you choose your prescription drug program. Now, you, again, like I said, you sign up for A, B, D for drugs, and then you add your Medigap supplement policy, because this supplement is what will pay the deductible from Part A, because you don't want to pay $1,556 if you're admitted into the hospital every time or every episode. So the Medigap plan pays for it. The Medigap plan also pays for the 20% coinsurance that is not covered under Medicare Part B. And these Medigap plans, there's different types of plans. There's Plan A, D, F, G, N. Medicare likes letters, if you haven't noticed that. So sometimes our clients, they call and they want to talk about Medicare Part A, but they refer to it as Plan A. And I always make that correction because there is a Medigap Plan A, completely separate from Part A. So these supplement plans have different premiums. Supplement plans premiums do increase as you get older. So they get a little expensive as you get older. And so if you're 65, you can find a supplement plan from between $70 to $185. Then at age 85, a supplement will cost you anywhere between $300 and $425. But why do people sign up for supplement plans? Because they don't want to have a primary care doctor. They don't want to go and get a referral. They don't want to wait for authorization for certain treatments. With Medicare A, B, and a Medigap policy, you if you are on a walk and you twist your ankle, you can call your orthopedic surgeon and you can get in and see him as soon as they give you an appointment. You don't have to go to your primary doctor and ask for a referral. So this is why people sign up for these Medigap supplement plans. Again, these increase as you get older, and some supplements like F and G, they offer vision, hearing, travel insurance, a fitness membership. There's a lot of perks that they also offer. Your supplement plan in California, only for California residents, your supplement plan renews on your birthday month. So on your birthday, you get a happy birthday letter, and then you get a rate increase for your supplement plan. That's just how it works. In other states, once a Medicare beneficiary selects a supplement plan, they can't change it. They have to keep it. That's the insurance company that you're stuck with. Here in California, you can actually move from supplement plan G with Blue Shield, you can move to Anthem, and vice versa. So there's that movement that is allowed in California, but it's not allowed in other states. And again, this renews on your birthday month. Then here, I really like this slide because Medicare really is the puzzle pieces, right? Which parts go together. And again, when you sign up for Medicare, you'll sign up for Part A for hospital coverage, Part B for outpatient services coverage, then Part D for your prescriptions, the Medigap plan, which will cover the deductibles from Part A, the coinsurance from Part B, so that you are not exposed limitlessly. And so this type of coverage gives you that flexibility to go to any doctor that accepts Medicare assignment. Your other coverage option is to sign up for A and B, but then you sign up for Part C. And so what Part C does is it takes over your A and B benefits. And so you no longer have the freedom to go to any doctor that accepts Medicare assignment. You now have to go to doctors that are part of the network for the plan that you selected. That's why it's very important that when you're selecting your Part C plan, that we confirm that your Part C is going to pay for your prescriptions and that you'll be able to keep your providers. Because once you sign up for it, you'll have to see providers within that network. And so these Part C plans are what are known as bundle plans. because they include the prescription coverage, and then they include a maximum limit for services so that you're not exposed limitlessly the way you would be if you only had Medicare Part B. Now, again, if you are still employed and you work for a large company, then you can keep your large group employer coverage, but we recommend that you sign up for Part A because it's premium free. You don't pay for it when you enroll, but you paid for it in advance. It's prepaid. You paid it through your FICA taxes. So why not take advantage of that extra hospital benefit that may kick in if you're ever hospitalized? So these are the different puzzle pieces and how you would piece together the different coverage of Medicare. And on our last slide, you have our contact information. All of you have Tori's contact information, but if you have any questions, you are always welcome to reach out to our office. We do just specialize in Medicare. That's all we do. And, we're AHIP certified. We go through training every year, and we can help, if you're not planning to retire anytime soon, but you want to find out how much it'll cost you to go on Medicare, we can help with that comparison. And you want to do that for financial planning because sadly, I often meet with clients who actually have already notified HR they're retiring, and then they find out how much they have to pay for their medications under Medicare. And so they have to, I think this year I had maybe 6 individuals go back to HR, and for one of them, it was too late. HR didn't accept, he couldn't take back his retirement paperwork. And so, this is something that you want to do before you let HR know that that you're going to retire, because you may not be able to, put a break on your retirement if you choose to do that after you've submitted your paperwork. So we can now open the presentation to questions. If anyone has any questions, I'm happy to answer those. I know it's a lot to take in, but we do have a recording and Tori will share that with you. You can, listen to it again. Feedback is that every time our clients listen to the recording a second or third time, they always catch something that maybe, you didn't catch the first time around.
Yeah, thank you so much, Fanny. I have one question, if anybody else doesn't, that I'll just kick off the Q&A section with. So why are you not able to apply for Medicare if you have an HSA plan? Is it just like also new contributions into an HSA? Like if you have one already, is that okay?
So if you have an HSA plan and your employer may make a one-time or a fee deposit either at the end of the year, at the beginning of the year, but you maybe are making yearly contributions because you are making pre-tax contributions. So it's a tax advantage. You're not being taxed on your deposits into the HSA. And so federal rules are that you cannot take a tax break and be enrolled in a federal program.
Right.
And so, as I say, Part A, you prepaid it, but it is a federal program, so they won't allow it. Now, if you have an HSA, you're retiring, sign up for Medicare, those monies are yours, and you can use those monies to pay for your Part B premiums or co-pays. You can continue to use those.
Okay. And will you get penalized if you do add into an HSA and you have Medicare Part A? What's the penalty?
Yes, so there is a tax penalty, and so this is actually also very individualized because the tax penalty is a percentage of your modified adjusted gross income. So it can be as little as 15% or as large as 40%. So it varies.
Okay, so just don't do both at the same time if you can.
Correct.
Okay, any other questions for Fanny?
I know that it's a lot of information. This webinar used to be 40 slides and we just found it was information overload. So we've condensed it, but as a title of the presentation, these are Medicare basics. Mm-hmm. And if there's one thing that you should take away from this is that very little of Medicare is basic and the same for everyone. Most of it is very individualized. And so it's, you have to do some research, and what works for your neighbor may not work for you.
Exactly. Yeah. And Fanny's helped many of our clients in their Medicare supplement plan selection journey. And she takes really great care, really looking at whether or not, like if you're still employed, to you keep using your employer plan, or maybe it makes more sense cost-wise to apply for Medicare. So she really looks at every single aspect of your own individual plan. And then each year, like as the prescriptions and drug coverages change and policies change, Fanny keeps up to date with all of it. So if you want to partner in your Medicare journey, you can schedule a time with Fanny to ask your questions. But I'll be sending a follow-up email with her information and the best way to get in contact with her. But thank you very much for allowing us to guide you in your journey toward a healthy and fun retirement. Thanks for being here, everybody.
Thank you.